We are wrapping up now with our final session and interview, and I am excited to have this sort of fireside chat with Claire Zangerly. Claire Zangerly is a highly accomplished healthcare leader whom I admire very much. And I think her and I met at from our mutual interest in the American Organization for Nursing Leadership. So she is on the board and I'm on the foundation board, and I think we met at a soiree, and I just really admire her dedication, and was thrilled when she accepted my offer to be a charter member of the Avisher's Chief Nurse Executive Advisory Board. And so she brings just a wealth of leadership and healthcare background and a perspective. And she most recently served as the Chief Nurse Executive and the chair of the Nursing Institute at Allegheny Health Network in Pittsburgh, where she was responsible for shaping and leading nursing strategy without the whole integrated health system, which across 3 states and with over 6,000 nurses under her leadership. She also served as the CEO of the Visiting Nurse Association in Ohio, which is the largest home care and hospice organization in the state. So that's like a different background that she also has experience. And she brings her experience in her various roles at the Cleveland Clinic before that, where she was the chief nursing officer, but also chair of the Nursing Institute, director of quality and accreditation, director of preventive cardiology. She's currently serving as the executive nurse advisor for a private equity firm and consulting on health systems across the country now in the practice of nursing leadership and healthcare operations through her company, CMZ Strategies, LLC. So now she's taking all of that, putting it together, and kind of has a much larger sphere of influence at this point in her career. She has been dedicated to addressing nursing shortage before it was cool, and has successfully implemented innovative programs to attract, support, and retain frontline healthcare workers throughout her career. Beyond that, sort of all those quote unquote day jobs, she has also served as a trustee of the American Hospital Association and holds a position on the board of directors at AONL. And then when in her downtime, she just also does little editing on the editorial board for the Nursing Administration Quarterly and Nursing Management. And congratulations, Claire, for being recognized as one of the modern healthcare's top women leaders in healthcare in 2023. So that is a huge honor. And thank you for taking the time out to have a little chat with me today.
Thank you for inviting me. It's great.
Great. And I kind of started with talking about your history and passion about focusing on supporting and retaining frontline staff. I think that's probably why the AHA board and the AONL board has asked you to take a leadership role now on the workforce task force. And so you could bring your unique perspective in different settings and different leadership roles. And can you talk a little bit about what that task force is doing?
Sure. You know, workforce is on everybody's mind right now, because workforce, we're nothing without our workforce. And even before it was something that we had difficulty with, we always supported our workforce. My doctoral work is in workforce. When I went on to when I got into the academy, that was part of my application, was all about workforce. So I can tell you that AONL and AHA are very dedicated to contributing to the issues that we have around workforce. Specifically on the AONL workforce task force, which is a mouthful, I serve as the committee co-chair with Deb Zimmerman, who is the CEO of Daisy, and she's coming in as the AONL president next year when Eric Martin's done. And we sort of divided and conquered. And we're looking at 2 very seminal things that I think are super important for us right now. Model of care, which everybody is talking about, and you just heard a little bit about model of care in this last video, and the actual nurse manager turnover. So model of care, everybody's talking about, we have to change our model of care. We have to look at our model of care differently. And yes, we do. And but what does that look like? AONL is working with IHI and Johnson & Johnson to pull together all of the information across the country. What is everybody doing? What is everybody doing around changing their model of care? Is it changing the discipline? Is it bringing in virtual nursing? Is it working with companies like Avasure to bring a new model to the bedside such that we are not overburdening our staff any more than they're already overburdened because of the shortage? So that work is moving along very quickly. And then the other piece is looking at nurse manager turnover. We know that we have a problem with nursing turnover. We know how much it costs. We know what the issues around it are. But what we haven't really looked at and what we don't have a lot of information on is the true value of the nurse, of the frontline nurse leader. And when that frontline nurse leader turns over, the tentacle effects that has across the, not just the unit where that nurse manager was, but just across the organization in general. We want to quantify it through what does it cost in terms of turnover, vacancy rates, quality, safety, even morale, culture. What does that look like? So a lot of great work is going on with that. So these are tools that we want to bring to the AONL membership and beyond to share with nurses so that we can not just share it, but people can have some really good things to act upon to improve the work of their own organizations.
Wow, that so I think a lot of our audience today are nurse managers. So those that are nurse managers out there or nursing directors and chief nurses who are supporting nurse managers, I hope you're feeling the love. And I hope you heard that Johnson & Johnson, IHI, American Hospital Association, AONL, Claire Zangerly, and the Daisy Foundation are all focused on, working together and collaborating, focusing on, I think that's key, that nurse manager role. And then also you talked about models of care. And so I think models of care, and I'm sure in the afternoon or the session that we've had today has been mostly focused on the inpatient models of care. So let's talk about that a little bit. And can you talk about any political advocacy that you've been doing along models of care, and also how the task force is looking at that?
So AONL and AHA are very focused on policy and advocacy for members, for non-members, for all the hospitals and caregivers across the country. And everybody knows that most recently in the last year or so, what we have been faced with is the debate over mandated ratios and what that looks like for us. We have, ANA just came out supporting mandated ratios. AONL had a response to that, saying that mandated ratios are not necessarily the way to go. So we have a little bit of a in our nursing ranks right now around mandated ratios. There are good points on both sides. It's AONL stance that mandated ratios do not create more nurses. And those with mandated ratios, we are still trying to determine if the mandated ratios have brought better quality, better outcomes. That is a debate that's still out there. But those are things I think that all nurses should weigh in on, what that looks like. And when we're talking about mandated ratios, everybody thinks, well, that's just for union type organizations. The legislation that is being proposed out there is not mandated ratios for just union organizations. It's mandated ratios for the entire country, whether you're a union shop or not. So it's a very difficult place right now because we don't have enough data that shows us that mandated ratios create more nurses or bring more nurses back to the bedside or bring nurses or reduce turnover and reduce vacancy rates. What we do know is that we have to do something. Whether in whatever it is, we have to do something. We have to stop just talking about it, and we need some government intervention to help us with that, but we don't know exactly what that is. So that's why we want to continue the dialogue, yet not just talk about it, but say, let's put a stake in the ground. And I think what has happened is because we haven't seen any movement from our legislators on other things that we think is important, such as increasing the reimbursement for nursing instructors so that we can get more nursing instructors into organizations to teach, to produce more nurses, those types of things, then we're looking for just anything to help us address this issue. But policy is always something that's that's high on the list of both AHA and AONL.
Thank you for all the work that you're doing and dedicating to that and being a voice. Nurses every year are voted as the most trusted profession, and we are one of the largest, but we are not always the most influential. And so we need leaders like you and at AONL to be that voice at the table and help us solve these problems together. This afternoon, and I'm glad you mentioned the previous session. So there have been several sessions. I say this afternoon because I'm on the East Coast, but we have, across the country, today we had several sessions that really talk about different ways of delivering care. So kind of different care models that we were talking about. Just on the last session, we were talking about virtual nursing. And it's a rural hospital that was using a virtual nurse, especially in woundostomy and diabetes educator nurses, to provide access to their much smaller critical access hospital and increase patient satisfaction that way. So that's one way to do it. We had a lot of sessions about virtual sitting as well, because that helps get, and that's not RNs, but that helps the nursing assistant staff get back to the bedside while keeping patients safe. So yeah, I think you and I met at an AONL soiree because we're both involved in AONL, but I think at the same time you were also on the implementation phase as a nurse leader in your health system for implementing AvaSure. So can you tell us a little bit about your journey and what problems you were trying to solve and how you addressed that then?
Sure. Well, like every other organization, we had patients that needed eyes on all the time. And even without a shortage of nurses, we were not able to have nurses have eyes on all the time. And what we were doing is we were taking our very scarce nursing assistants and pulling them into the patient room to literally sit with the patient. Just sit there, make sure the patient was safe. And when we pulled those particular individuals in to do that, that took away from the other work that they were doing in their nursing assistant practice with other patients on the floor that was more dynamic than just sitting. And we said there's got to be a better solution. And that was even before COVID hit. And we started talking about we need to look at a virtual model because we saw across the country where other people were doing this, and we were seeing that the outcomes were very good. And so we started talking to different companies, and as everybody knows, during the pandemic, so many virtual companies came out of the woodwork that purported to tell us that they could solve our problems for us. Well, we were very fortunate that we had already done our research with AvaSure and other companies like AvaSure, and AvaSure rose to the top for us because we saw the outcomes, we saw the potential beyond a sitter program. We saw the potential for once we get our feet wet and get established with a sitter program, there are other options that we could tap into, because not only would the sitter concept be successful through a proof of concept, we could move on to something else. So we knew that we wanted to reduce falls. We wanted to make sure that our patients were safe, but we also wanted to have our nursing assistants work at their top of license. So that's why we thought it was such a great idea to pull AvaSure in. At one point too, we talked about doing a homegrown system ourselves, and it made zero sense to us, because we are not the experts on that technology. We're not the experts on the failing of it, the success of it, and we wanted to work with the experts to show us how this worked with other organizations. And we were lucky because other organizations had already made some mistakes. Those mistakes were corrected, and we were the benefactors of that. So we felt like we wanted to focus on what we were good at, and what we weren't good at was setting up our own sitter program. So, but what we were good at too was recognizing we needed the program, and we were really good partners, and we had an opportunity to partner with the best company to put this out there. And then as we were partnering with this company, see how we could even move farther into virtual nursing going forward. So it worked out really well. And you know, the thing with AvaSure is, and I'm sure other companies are this way too, but we felt very much that AvaSure listened to us, and that no question that we asked was the wrong question or a silly question. But we also said, this is what might work for us. Can we do this instead of what you're proposing? And AvaSure was so flexible, nimble, and versatile for us. And I think that's what made it a successful relationship, and continues to this day.
Thank you so much for saying that. We have some people in the room here today who are feeling like proud because they're the ones that are, you know, working with nursing leaders. And sometimes nurses here accidentally call our customers our patients, and they're like, so I had a call with a patient, hospital yesterday, and you know, so we do really care. So it's nice to hear that. And as we're talking about virtual care and expanding that, we conducted some market research earlier this year, and we used the same research group that Jocelyn Insight that is used by the DAISY organization, and we partnered with AONL on this research, and we had almost 800 respondents and nurse or hospital leaders. 20% of them were CNOs, and there were some interesting findings. And one of the questions we asked, what were the most important reasons to implement virtual nursing? And this is where the nurse leaders' answers diverged quite a bit from those who were not chief nurses. So those who were not chief nurses listed patient quality and patient safety as first and second. And the CNOs listed nurse satisfaction and improving the workload and burden of current staff as 1 and 2. And I don't know if you answered that survey, or if you would, why do you think that was different between those groups?
Well, the results don't actually surprise me, because for nurse leaders, the patient safety and quality are table stakes. That's just for sure. But what's also very important to nurse leaders, CNOs, is reducing the workload of their staff. Their staff are first. Everybody knows patients are the most important, and that's just understandable table stakes. But what is important to the nurse leader is to make sure that their staff has a better, a less burden. And so I'm not surprised that that's what they answered as first, and I'm not surprised that the staff answered patient safety and quality.
Yeah.
Because that's what they focus on as well.
Yeah.
You know what? I'm glad to see that they didn't say, well, I want this because it's going to make my life easier. Because that's not what they say when they're nurses. Sometimes we wish they would, because we want them to take care of themselves. But for them to put the patients first, and for the CNOs to put their staff first, that doesn't surprise me. And I think it's great. It's a great response.
Yeah, you're right. I love that way you looked at it that way. I thought about it slightly differently. I think you're right. And also, I think it's kind of like you can't get patient and quality safety unless your staff is able to provide it, and that they're well cared for and are able to be satisfied, be engaged, and not be overburdened. So I think one leads to the next, and I think it's kind of a fun finding. But everybody agreed on number 3, which was patient experience. And so, and I think it's gotten proven over and over again that virtual care improves patient experience. And then a last interesting finding was that on the CNO group, there was a question: do you believe virtual nursing will become an integral part of care delivery models in acute care in hospitals? And only 1% of the CNOs disagreed with that statement. So I think we've got some major consensus that we really need to put our momentum forward, but getting into virtual care in the near future. But you and I spoke recently, and you said something about patient experience that I loved so much. I actually wrote it down. You said patients are asking us directly and indirectly for this. So can you tell me, expound a little bit about how patients are making their expectations clear?
Well, so we have pushed patients to be consumers. We've pushed them to say, you have to meet us in this journey of taking care of yourself. And as they're doing that, that means that they take responsibility, and that's through virtual care. They want it to be convenient. They want it to be expeditious. They want it when they want it. It makes me think of last night when I was in the Philadelphia airport, and I went to my gate, sat down, and plugged in my phone to charge back up, and there was a little screen there. And if I wanted something to eat, all I had to do was just push a little button on a screen, and somebody would literally deliver it to me. That's exactly what our patients want. They want when they want, what they want when they want it, and they will participate in their care if they have that convenience. So we have to step on that train with them and say, okay, this is how we can deliver it, and we can still deliver really good, high quality care this way, a little bit different than what you're used to, but it's another way to deliver it. And if you love it, then you can take advantage of it at the highest level, and that's gonna continue to help you on your health journey.
That's a great example, and that is the expectation, and let's do it. And we can do it and just even be more efficient while we're doing it. I'm going to be honest, I really look at you as a role model because your sphere of influence continues to grow. You're a nurse's nurse, and I read your bio, so you know that everyone knows you've been in different areas, and now you're kind of having national influence. So from your perspective, in your background, what are your hopes for the future of nursing and healthcare?
Well, everybody knows this is a very interesting time for us in nursing. It's our time to step up and make some decisions. It's our time to continue to be listened to, and I think we are being listened to. I think that we have to take advantage of that. I think we also have to tell people how great it is to be a nurse and what it means to be a nurse, because you know, we're in danger of people saying, oh, that job's too hard for me to do. You know, everybody wants to work remotely now. You can't be a hands-on nurse and work remotely. So we still have to promote the value of human interaction. Human interaction is so important, and I think that is something that we have to focus on. You know, we don't have enough staff. We know we don't have enough people doing that human interaction that needs to be done every single day, right there in person, whether it's within the 4 walls of the hospital, whether it's in an ambulatory surgery center, whether it's in a community health center, wherever it is. We know we don't have enough people. So that's why we have to meet the patients where they are. So, and we have to think of different ways to meet patients where they are. We're not putting together, you know, these different thoughts around virtual nursing because we don't have enough staff. It's because that's what patients want. So not only are we delivering to the patients what they want, we are looking at ways to make sure they get what they want. And that's what I think is important. And like you said, nurses are the most trusted profession. They're trusting us to figure it out. And I think if anybody can figure this out, it's a bunch of nurses. And I can tell you, I feel really good about what we're doing every single day to do that.
Thank you so much. It was great talking you today. And I'm gonna, that's a key phrase from today. If anybody can figure this out, it's a bunch of nurses. It just so happened that every interviewer this morning, a facilitator today was a nurse. And I also loved what you said about the human interaction. So I'm gonna close with a few things that I heard that were so human today. It was about the virtual safety attendant that noticed the patient looked different the next day. The patient actually was having a stroke. It's about that patient that wanted to make sure he waved goodbye to the Tom, his virtual safety attendant at Freighter before he left. It's about the marriage proposals that virtual safety attendants got at UC Health in Colorado that we talked about at our webinar with them. So I love, let's keep that human interaction. That's what nursing is all about. And thank you everyone for joining us today.